in time, and we join those sessions. That is going to be the order throughout the days. We are going to be having 3 parallel sessions every afternoon, and we're going to be having prenatal sessions in the mornings. Day 2, which is tomorrow, we're going to have 3 prenatal sessions, very interesting, every day. Day 3, we're going to have 2 prenatal sessions. We're going to have other interesting activities taking place in this conference, and we are going to learn much. So I think now our task is almost coming to the best of the end.
Yes, sadly, it's coming to an end. So, so as you mentioned before, make sure you do know the plenary session you want to go to so that you don't find the seats taken. And so without any further ado, I think we should welcome our next speakers. We should start our next plenary session. So the guest speakers will be Professor Philip Cotton and Honorable Dr. Papias Musafiri. And also we'll be having Dr. Ulu and Professor Mary Foley. And without any further ado, let's welcome our moderator for today. So she's called Maggie Mutesi.
Maggie Mutesi is a journalist at Rwanda Broadcasting Corporations, and she's the winner of the annual, she's the best female journalist in Rwanda. Maggie Mutesi, you can take us to the next session. For your information, this event is going to be live streamed, so if you have your colleagues that are not here, they're going to be following this event live. Thank you very much.
A very good morning to you all, and I hope you had a wonderful evening, and I hope for all those who traveled from other countries, you used Rwandair. If you didn't, don't worry, we'll forgive you, but next time please do. And my name is Maggie Mutesi, and I'm a journalist with Rwanda TV. I'll be your moderator for this first session today. But I would love to emphasize a couple of things before we start off as we wait for Professor Cotton. There are different ways in which you can intervene in this discussion. But first, especially that you're in Rwanda, you need to first be connected to internet, either by Wi-Fi or mobile data. And we will be using hashtag WHSS2017. You can send in your questions if time allows. I'm sure the panelists are also connected. They'll probably be answering some of those that I won't be able to read out. Secondly, I will be coming to the audience after a few questions to find out what you think or to hear your reactions, your views, any questions to the panelists. And the third way you can intervene is to remember that the conversation is about you. So you can feel free to ask any questions. In the meantime, as you connect to the Wi-Fi, I think we'll be waiting for Professor Cotton. I'd love to ask the organizers to help me with the Wi-Fi passwords or username so that the audience can be able to share the discussion with the audience outside this particular room. So once again, welcome to the opening session focusing on the role of multidisciplinary healthcare and SDGs Agenda 2030. I want to take a step back and we look at the Sustainable Development Goals and what we are aiming at. We want to transform the world and promote prosperity by 2030. And I mean, we want to do this in 13 years, from now in the next 13 years. We really need to have healthcare for all. But today we'll be prioritizing goal number 3, which is to ensure healthy lives and promote well-being for all. And we believe that the goals to be achieved, everyone needs to do their part. Welcome, Professor. And we need different stakeholders, governments, civil society, private sector, including you, the young people. We all have a role to play to be able to achieve these goals. Now, I'll put down a few statistics. In the case of Africa, Africa still accounts for 200,000 of 289,000 mothers who die every year from pregnancy. Now, as of 2015, mortality among children under 5 years of age remains high in sub-Saharan Africa, with a rate of 84 deaths per 1,000 lives births. Now, Africa is also still home to 60% of people with HIV/AIDS. I want us to note that a lot of progress has been made. In Rwanda alone, 97% of infants are immunized against 10 diseases, and 80% of teenage girls are vaccinated against HPV, compared to only a third of 13 to 17-year-old girls in the US. Now, amidst all the steps taken, the problems are rapidly evolving with with very many challenges, especially in sub-Saharan Africa, and we'll be looking at moving forward how to achieve these SDGs. And please allow me to introduce my panelists this morning. I'll start off with Dr. Olushayo Olu. He's a public health physician who specializes in management of infectious diseases. Now, he has over 26 years professional experience working as a public health specialist with several organizations in Africa and Asia, including the Ministry of Health of Nigeria. Now, he's also currently the head of the World Health Organization country office in Rwanda. I can't finish his bio, so I'll stop there. Next to Dr. Olu is Mary Fowle, who is a clinical professor at the University of California, San Francisco. She is also the director of the Center for Nursing Research and Innovation at the university. She's the president of the American Nurses Association and the National Student Nurses Association. Thank you so much for having time this morning. And lastly is the Vice Chancellor, Professor Philip Cotton, who is the Vice Chancellor of the University of Rwanda, a family physician, and he was also formerly the principal of the College of Medicine and Health Sciences in the university. Once again, thank you so much for having time to be here this morning, and to my panelists, thank you for having time to be here this morning. So I want to start off the conversation with the fact that in the African region, in the African perspective, Dr. Alu, but I would love us to put in mind that these goals we're talking about are long-term, meaning that we need to look at strategies that can be sustainable to be able to achieve them. Now, we cannot achieve this development if other things are not put into place. Looking at poverty, in 2012, the African Development Bank highlighted that 43% of all Africans still live below the poverty line. Looking at quality education, among many other challenges, I want to start off with the fact that what do we need as a starting point to move towards achieving good health?
Hello.
Let me give you this.
Okay. Thank you, moderator. Thank you very much, moderator, for the question. Let me, first of all, on behalf of my organization, the World Health Organization, congratulate the organizers of this meeting. I think it's been really a long way, and we are very proud and happy to have been part of this, both financially and technically. To start, when you look at the way we define health, we say it's a state of physical, mental, and social well-being, and not just the absence of an illness. So what does this tell us? It tells us that, look, health is not only about good health or having good health care. It's not only about the health system. It's about so many things that come together. So if we must have good health, the starting point will be actually having this multidisciplinary approach, which looks across so many things. And I will go through each one of them briefly. I think this first starting point will be the healthcare system itself. We really need to build it. We need to make it strong. And I'm talking about several components of it. It includes our healthcare workers. So we have students who are here today and young healthcare workers. So we really need to develop this and make sure that they are able to handle most of the key issues around health. Of course, financing is really important. Whatever we do, we need to have inputs. And one of the critical inputs will be to look at the issue of financing. Another key area are the products, the medicines. If we want to take care of people, we really need to have a good supply chain system to ensure that, look, we have the right products at the right quality and in the right place. And of course, we have the issue of information, health information. This is really critical. If we must plan very well for the SDGs and move things forward, we need to have evidence to be able to plan much better. Importantly, we have the governance aspect of it. There has to be oversight. There has to be monitoring and evaluation. There has to be supervision, and we need to have this in place as well. And last but not the least is the service delivery itself. We need to deliver services that are equitable, that are of good quality, and that actually covers all the broad spectrum of healthcare needs of the population. Now, the second main area is the issue of the social and economic determinants of health. Like I said earlier on, health goes beyond health, the health sector. So there is no use for me as a physician to treat a patient for malaria and send him back to a community where he has no access to water. He will be back again with another illness which is water-related. So we also need to address the social and economic determinants of health, which includes water, sanitation, housing, income generation, and all the rest of it. Importantly, we know that disasters has a lot of impact on health. So if we must deal with and provide good health, we also need to look at how do we protect our people from the impact of disasters. And I look at countries like Yemen today. Yemen is undergoing a very, very serious conflict and has a massive, massive outbreak of cholera. And it's increasingly difficult for us as international partners to actually help them because we have insecurity. We cannot access most of the people. So for me, I think this is another critical area that we need to look at. Now, putting it all together, how do we put all this together? We must have the leadership. I think for me this is critical. A leadership that is committed, that is interested, and provides a platform for accountability. Secondly, I think we also need to look at having a system that ensures universal access. And when I say universal access, it means everybody should be able to access the health care they need, wherever they are, and should not have any financial hardship. And importantly, I think we need to protect our healthcare system. Thank you very much, moderator.
Dr. Olu tried to summarize everything we actually want to discuss. But don't worry, we'll drill into the conversation and look more into what the different organizations are doing and what more you can do as students, young people, and the different stakeholders. I'll move on to Mary. What do you think needs to be our starting point addressing this?
Yours off? There you go. Hi, good morning, and thank you very much. It's a privilege to be here with you, and particularly to you, the students, because you are our future. So thank you for being here and showing your commitment to the notion that this conference is grounded in, and that is that we have to work in a multidisciplinary manner. No one health profession can conquer all that needs to be done, and we have to do it together. So I really appreciate the program, the structure of the program, and the type of multidisciplinary participation that I'm seeing here today. Very importantly, this kind of connection and these conversations have to continue for us to be able to make a difference across the globe. I do bring you greetings from the National Student Nurses Association in the US, and I was with them recently at a meeting, and their message to me to bring to you was to work together in a multidisciplinary way. Tomorrow we'll talk more about how to learn together in education in that way, and also how to practice in that manner. I'm also very aware of my own cultural humility, and I have to be very honest that the US, why some people look to us as having all of the solutions and more money than anyone needs, we have not achieved global health or universal health. We still struggle as the most developed country with one of the worst maternal death rates in any developed country. It's on the rise, unfortunately, not on the decline. And we have to look at the social determinants of health, the structures that are leading to that particular demise and concern. And it is, as the doctor said, beyond just health care. In general, if you go to our hospitals and a woman experiences a health crisis during delivery, the management of that health crisis is usually quite well done. But we're discovering that our citizens are experiencing high rates of obesity and diabetes. It's a lifestyle and culture problem across all of our races, but there are certain racial disparities and ethnic disparities in our access to care, in our poverty levels. So we struggle as well to achieve better health and to work toward the goals. So I'm happy to participate in the conversation. I can honestly tell you we don't have the answers, but we have the desire to participate in the conversation, and I think that's what will move us all forward toward better health. Thank you.
Thank you. Professor Curtin, now the academia is very important, especially in terms of building capacity to achieve this common goal. I want to look at the work you've done in Rwanda in the recent years. You've worked closely with the students at the University of Rwanda and different stakeholders, where you've emphasized the need for research and open data. Can we take a look at some of the work you've done, but also how has been the experience for you working with the different sectors in Rwanda? Have they been supportive?
Thanks, Maggie. Yeah, if I can tell you something about what we've been doing in the University of Rwanda, which may sound a bit like a brag and a boast, but I think it's important because the most important starting point for this kind of discussion is context. So the context here is that the University of Rwanda is now the second most impactful university in East Africa, based on the normalized citation index of our research. In fact, the most prolific publisher with an average of 9 international peer-reviewed articles a year is the Dean of Medicine, Professor Stephen Rulisa, within the University of Rwanda. And our impact factor has grown more than Johns Hopkins University, more than the University of London. We have a meteoric rise in research output. And the reason for that is is twofold, is that we have started to focus on research that is rooted in people's lives, is rooted in the experience that people have, and research, therefore, that has an impact on people. So beyond the publication of the research, what is happening with the output of that research? The other thing that we've done, Maggie, and this is from independent verifiers, is that we've begun to change the culture within the university, the way in which we do things, the way in which we conduct research, the way in which we inform education. One of the key things is that we need to have an education system and a curriculum that's much more flexible, much more agile. So in resource-poor settings, the luxuries of medical curricula and nursing curricula get squeezed out often with an obsession with knowledge-based intended learning outcomes. So we lose the issues around understanding the healthcare system. And we know that many students who come to universities don't always have experience of the healthcare system in their country, from village level right up to tertiary teaching hospital level. So we need to help people understand the system. We need to help people understand the model of healthcare. So curative model of healthcare is probably pretty outdated in the world. We're looking at a much more palliative model of healthcare. What about medical law? What about medical ethics? What about health economics? We've squeezed these things out, and we need to bring them in much more closely. We use textbooks that come from the northern hemisphere, and you simply have to look at the size of the chapters in those textbooks to realize that if we allow those textbooks to drive the learning of our students, then we will fail to equip our students with the knowledge and practice and skills and values and attitudes and behaviors that they need to work in this context. One of the beautiful things, one of the many beautiful things about Rwanda is that our government ministers work in 3 clusters: a governance cluster, an economics cluster, and a social cluster. And the Minister of Health and the Minister of Education operate together in a social cluster with the Ministry of Local Government, Public Service and Labour, Agriculture, and others. So that when there's a problem, such as how we're going to tackle childhood stunting, everybody comes together. The Minister of Education avails training for teachers, the Ministry of Local Government avails space for local farms, and gets the local districts involved in growing fruit and vegetables, in talking about nutrition, and the Ministry of Health does their part too. So, and we as the only public university in Rwanda have a huge amount of input into that, and indeed we provide a lot of the evidence for those discussions. And so what is critical for us is to make sure that the research that we do and the teaching that we do gets shared with everybody and gets disseminated and is made sense of for people. Maggie, I hope that's okay for a start.
Yeah, sure. Thank you so much. Now, Dr. Olu mentioned something very important. I want to come back to it, financing. You know, we're talking about sustainable development goals. It means we need sustainable financing to be able to put in place the health care systems to be able to build hospitals. And maybe we should understand, actually, when we talk about achieving health for all, are we just talking about hospitals? What are we even talking about? But I'm sure my panelists will be hitting on that as we go ahead with the conversation. So I really want to talk about financing, Dr. Olu. When we look at the developing countries in terms of achieving, hitting the targets for MDGs, one of the reasons they pointed out as to why these targets weren't met was because of financing. I'm sure it's probably the same reason globally. But we have been attracting funding. I don't know why we still say we haven't had enough funding to be able to meet the goals. My panelists can help me understand. As the World Health Organization, how are you working with the different governments to ensure that we attract sustainable funding?
Okay, yeah. Thank you very much, Maggie. I think First of all, financing is only one critical component. And if we have all the money on the table and we still don't have the other components, then we will not get there. Secondly, when you talk of the issue of financing, we need to look at it from two perspectives. The first is increased financing, okay? And then the second is the cost of producing health. So even if we have all the funding and the cost of production of health is high, then we're going to have a problem. And that remains, a major issue in Africa. Now, when you look at, things like even the leakages from the system, poor planning, things like, lack of, commitment and inappropriate, evidence to guide us exactly where to put the money. These are challenges that we face, in terms of, financing health in Africa. Now, if you ask me, is financing a problem in Africa? Yes, I would say yes and no. In the sense that if you look at a lot of our countries, we do have enough domestic resources to actually finance health. But the problem is, most times, we don't have the political commitment to do it. So for me, I think the first thing to address, if we must address the issue of sustainable financing, is the advocacy and political commitment to put the money in health. Of course, not only health, we need to put money equitably across the different sectors. Now, when we talk of financing, like as earlier on said, we need to look at reducing the cost of production and increasing funding. How do we reduce the cost of production? I'll give you a number of examples. When you look at the issue of planning for, let's say, essential medicines, sometimes we don't plan well. So we order for and procure huge stocks of medicine that ends up in a store, and then it gets expired at the end of the day. The medicine costs money. Storing it costs money. To dispose of the expired drug costs money. So this is a leakage that will need to be addressed. Of course, we need to look at efficient ways of producing health. I'll give you a very good example. Recently, I was at a conference on digital health in the UK, and a lot of talk in the nice room where we are about how digital health is the thing for the SDG, which I fully agree with. But we need to contextualize it, okay? What is the cost and what is the effect? So in terms of financing, we need to look at cost-effective interventions. We also need to look at efficient allocation of resources, putting resources where we will get the most impact. And importantly, we need to address the issue of leakage. We've had stories of drugs, products procured by government, by partners, ending up in the commercial market where they should not be. So there has to be some level of accountability. We need to increase funding, I agree. If you look at Africa, we depend heavily on external funding. We need to internalize our funding. A lot of people say, look, but some of these countries hardly generate enough income to even fund governance, talk less of health. In a way, I disagree. In the sense that, look, I'll give you an example. We have, things like alcohol, tobacco, the sugary beverages, which we know actually creates a lot of, public health problems. We can increase taxation for this. And we have seen countries like Botswana actually increase taxation for alcohol, which has reduced consumption and increased the amount of money which is available to implement health programs. I also want to look at, private sector engagement. I think this is really important. We need to engage the private sector. And we have a robust private sector all over Africa. As part of their corporate social responsibility, they can actually support, healthcare. And of course, having that kind of, partnership between them and also government, and of course, the public health organizations across Africa. Now, for us at WHO, what do? We do a lot of, advocacy to government to increase funding. What we have proposed is 15% of national budget. and we do a lot of advocacy. We work with government to ensure that, they have, very evidence-based strategy plan that are cost-effective and that can be implemented, given, the appropriate context. We do partner a lot with the academia in terms of training, to train people on health financing. We support, insurance system. Like currently here in Rwanda, we work very closely with the Rwanda Social Security Board to strengthen community-based health insurance. So these are some of the things that we are doing as an organization to support sustainable financing for health. Thank you.
I want to bring you in, Professor Cotton, on the issue of financing. Probably when some of us hear of it, we're talking about buying medicines, but I haven't heard so much money or funds being allocated to research, especially in the university. Actually, I haven't seen a budget being read where they say, okay, 2% is allocated to research. I don't know if you have experienced that. I want to hear your thoughts on this issue of financing.
Thanks, Maggie. We had a loud cheer from our Kenyan delegates. Within this region, within sub-Saharan Africa, Kenya and Rwanda are the two governments that have advanced this investment in research more than any other government. Now, if you look at the University of Rwanda, the only public university in Rwanda, so at the moment our staff are public servants paid by the public purse. And you look at the range of staff from professors down to assistant lecturers, and you take the average amount of their workload, which is about 25–30% of their workload that is dedicated to research, and you take a third of our salary bill, which is about 26 billion francs a year, then you can see that we're investing a huge amount in research, and we're beginning to see the effects of that. So there's actually a huge amount of investment in research. But the University of Rwanda produces 50% of all of the research that comes out of Rwanda. And if you look at that data that I referred to earlier, which positions the University of Rwanda second to Makerere in East Africa, and you look at research output and the impact of research output country by country at a country level, then the number one country is Rwanda. Rwanda has the most impactful research in East Africa. And that's because of the investment in research through Rwanda Biomedical Center, Rwanda Agricultural Board, and other government institutions, and the great output of that work. So there is actually a lot of money. We don't actually see a budget line often for research in health, but when we break it down, there's a lot of activity going on, Maggie.
Go ahead.
Okay, I just wanted to complement what the professor said. I think the issue of research in Africa also goes beyond funding. We need to build the capacity. Right now, if you look at globally, Africa only accounts for less than 10% of the research that is coming out from the world. And when you look at Africa itself, this is limited to a few countries, most of them in North Africa, a few in Sub-Saharan Africa, especially, like Professor said, Rwanda, and of course, South Africa. So we need to really build the capacity of our people. Next is, we often think that research should reside only in the university. No. Everybody should be engaged in research. Everybody that offers services. For instance, if you're sitting in a health center and you're beginning to see some strange trends, you can quickly look at it and say, look, why am I having this trend? These people, are they coming from a particular area? The people with this illness, are they of a particular age? So I think we also need to stimulate our people. And I'm happy that we have our young students and the future healthcare workers here today. One of the areas which I really want to call upon you to imbibe is research, because research gives you the evidence. And with the evidence, we're able to actually address all the issues around SDGs. Thank you.
Mary, I want to bring you in, Twain.
So many thoughts. What a wonderful discussion. Thank you. I'm going to briefly follow on the line of the research, and the area that I've worked in has been called translating research into practice, and it's the use of evidence-based knowledge in clinical practice, and that's been a very exciting role of many of us in the academic world, because the journals and the textbooks lag, some say, 17 years behind current practice needs, and the quicker we can communicate findings and breakthroughs and research that takes us in new directions, the better. So the evidence-based practice arena is one that's very vibrant and really gives the clinicians, you, the first-line health staff, the opportunity to access research and take it to your practice setting very quickly and make changes quickly. I want to just say on finance, I have a triangle that I use. This is a triangle that shows that where I believe dollars could be allocated at the very bottom for primary care, for preventive care, for the palliative care of our populations. Unfortunately, the triangle in reality, at least in our country, is flipped. We spend most of the money in acute care at the end of life, to be very honest. People in the US spend 80% of their dollars in Medicare are spent in the last 6 months of their life. And so we're not benefiting generally as a society, and it's the reallocation of these efforts and to say, let's flip that triangle, give excellent acute care when it's necessary, but strengthen the primary care, the care in the communities, the use of primary and pediatric outreach, community health workers, village care, because that's really where the essence of the changes will take place. There's a program in the US called the Culture of Health. It's launched by the Robert Wood Johnson Foundation, a very generous foundation who's really stimulated a lot of great work globally. And they focus, as the Sustainable Development Goals, not on health care, but on the notion of care, of food security. That a child who goes to school who is fed and has had oral care is found to be most ready to learn and to appreciate their education. That's improving the culture of health. That's improving the global Sustainable Development Goals across the entire list of goals. So it's a rich conversation. We have much to do. This is wonderful to have this conversation today.
Now you've heard from the panelists. I wanted to come to the audience if there are any thoughts, questions, before we proceed to other areas. Can we have the microphone to the lady at the front?
Hello. My name is Nadia Cobb, and I'm a physician assistant at the University of Utah. I work quite a lot with the health workforce sector at the WHO. And in discussing the financing aspect, I thought it was really important to also mention that the High-Level Commission on Health, Employment, and Economic Growth has made the statement that health is an investment, not a cost. And it seems very logical when we think of that, because when populations are healthy, and it means health in all sectors, social and economic determinants, obviously they're going to be able to have better education, have better jobs, et cetera, and that is going to increase employment. So I think that's an important bit in the financing. And I also think that when we think of the SDGs, that we need to think of the educational-based SDGs. We need to think, I have a little list, because I think they're so cross-cutting. Gender equality, reduced inequalities, and education and health. I think the beauty of the SDGs is that they link everything together. Thank you.
Thank you, Nadia. Any more questions before we, okay. The gentleman here. And please keep treating. we want the rest of the world to know about the conversation. Like we said, health for all. We don't want to leave anyone behind. I'll be checking the tweets as well.
So good morning, everybody. My name is Dr. Charu, and I'm representing India at the conference today. First of all, I'd like to congratulate all of you for such a rich and enriching conversation. I would like to compliment on the fact that everybody here is, they want to do their best to achieve a multidisciplinary approach for a better healthcare for the humanity. But in the end, we actually, we have to rely upon the funding by the government or by organizations. And in the end, we just play the blame game on not having enough funding. And that's a sad situation. It becomes very sad. So what we tried, we actually followed up a small plan in the rural villages of the northern India in which we didn't use any of the funds. We just went to the community, trained more people. As Dr. Olu said, it was the capacity building. And the high school students, the high school pass-out graduates, we kind of trained them to become midwives and trained them for a better healthcare in teaching about hand hygiene, sanitation, and how to use personal protective equipments and even safe abortion practices, and pediatric care about oral health and dehydration and electrolyte balances. Such small activities of 2 hours each per week created a huge difference, and we found out that the admission rate to the nearest hospital decreased by almost 47%. So I'd like to just bring to all the people here that instead of actually focusing on government and asking for more funds from bigger organizations such as WHO and UNDP, it's better to work at the community, go to your places, go to your people, talk to them, and work for them. And I would definitely congratulate Professor Philip Cotton for such an amazing work at University of Rwanda, and I'm a big fan of your oration, I must say. Thank you.
Thank you. Okay, we take one more question, and okay.
Good morning. My name is Ahmed Gamal. I'm from Egypt, and I am so proud to be a nurse. I am also membership director of GASN, the first global association for student nurse and novice. So I have a question. We are all healthcare students from all over the world. So we have a 17 SDGs goal, and we have specified or focus on the health goal, the global health and healthcare coverage. I think that we have much experience and passion to share another 16 goals. No poverty and the global organization and the global cooperation. I think we have the experience and we have the passion to work beyond the health goal also. So my question for you, that how can we as a novice nurse, as a healthcare student and healthcare team, how can we join to achieve the 17 SDGs? Because I believe that we can, that we are day by day face many categories of the community in our hospital, in our primary health care, even in our place of accommodation. We deal day by day with all the category of the community. So I believe that we can share and join the all 17 SDGs. So my question, how can we join all the SDGs goals? Thank you very much.
Thank you. So just to remind you, the conversation is about you. And you have a role to play, and the panelists will be addressing what role that is. Unless if there is a lady asking, I'll take one more question. If there's no lady? No. I'll come back to you after the panelists answer these particular questions. Dr. Alu, something that has been mentioned from Nadia to the gentleman, what role do they have to play? Community-based, I think I was coming to this, looking at the WHO and the fact that you have been advocating for this at community level. What do you have to say about the different views that have been raised?
Okay, thank you, Maggie. I think the role that healthcare students, healthcare professionals have to play starts right from the educational level. And I think one of the messages which I actually wanted to pass on to the two professors here is that we need to start to look at, the training. I remember that about 28 to 30 years ago when I was in medical school, we were only interested in clinical medicine. We had courses where we had to do community work. We never wanted that. So the starting point for you guys is, at this level, you need to look at the other sectors. Try to understand what is water. Try to understand even the political impact on health. Try to understand the economic impact on health. So I think for me, this is the starting point. 2, we also need to take health out of the healthcare facility. Like the colleagues from India have said, when you stay in the healthcare facility, then you are restricted. You are restricted only to look at the medical aspect of things. I'll give you an example. I remembered when I was working as a young medical officer in my country a couple of years back. We had a cholera outbreak, and I was sitting in the clinic. And one day my boss said to me, Olu, we have to get out of here and go and look at what is happening in the community. Lo and behold, when we got to the community, we discovered that, look, the problem was beyond us as healthcare people. There was no water. There was no sanitation. People did not know what to do. So it was at that point that, we started reaching out to the education ministry to look at the schools. We reached out to the Ministry of Water and Water Resources to provide the water. So the second thing is that you have to get out of that silo and really look at how you can deal, with the community and other sectors in a sustainable way. It's never easy. Everybody wants to protect his own turf. But I think if you reach out to the other sector, they will also reach out to you. Now, if I still have a bit more time, one thing that is really important is the community. I think we have spoken a lot about the health system, about social determinants of health. If we must achieve the SDG, we must take our communities along. We must listen to them. What do they want? What works best for them? And they must participate in whatever we're offering them. So community participation is so critical. The mantra of leave no one behind is really important. But look, the man who is seated on top of a mountain in his community there and has no access to health care, he needs to be able to do, understand what he can do in terms of preventing, disease and all the other issues there. So we must put a lot of emphasis on the community. Now, just quickly, WHO, as we have developed a strategy which is called Health in All Policies. And I think if you go to our website, you will be able to find this document. And it actually outlines how we as health can influence the policies in other sectors, to ensure that they include health, and how we can also bring them on board in terms of health. Thank you.
Now, I just want to throw in to what Dr. Olu has talked about in terms of community-based health services. Just in Rwanda alone, it's mandatory to have health insurance. This was introduced. Now, out of Rwanda's rather 14,837 villages have trained and equipped health workers who are equipped by the Ministry of Health to deliver key preventive interventions at the community-based level. I want to bring you in on the issue of financing. He's talked about the blame game. We're talking about funding, yet we could do so much. Nadia raised the same issue as well at the beginning. You want to throw in and share your thoughts on this?
Thank you. Yeah, I think I shared a little bit with my perspective that we need to re-envision where our dollars go. Again, I'm not here to represent the US health system, which is not healthy, but it's temporary. I am a believer in change and advocacy. And so I liked the challenge from our delegate from India. Just go and do it. Find the people that are interested in making the change. And don't wait if you don't have to. And if you can have resources and credibility in those communities and villages and towns, that's so critical. But I actually wanted to answer the delegate who asked, how do we, so this is a conference with the emphasis on health because you're health students. And you are absolutely correct. The rest of the Sustainable Development Goals, the SDGs, are so intertwined that we cannot achieve health if we don't meet the goals as they are outlined. I would ask you as students to take this kind of question back to your own schools and say to your fellow students, why are we not learning about climate? Why are we not learning about the impact of water and poverty and education and energy, all of the other elements, because they will affect or interrupt, they will be barriers to effective health. So when I teach and I do a policy course, I have students who are very focused on their clinical skills. They believe that's why they're in school. They're in graduate school to become a nurse practitioner or a midwife, and I present the SDGs, or I talk about leadership, or I talk about being an advocate, and they find it distracting because it's not about being a really good nurse practitioner. They will not be a good nurse practitioner or a good doctor or a good pharmacist unless you learn how to be an advocate and understand how this is all intertwined. So I really challenge all of us to be sure that there's policy and advocacy and learning beyond just the textbook and to become a great clinician, because we need you to help make that change. So you demand, your faculty can respond, and we can improve our educational system so as we develop great clinicians and practitioners, we'll also develop leaders and people who will work to make these changes realistic.
Thank you, Mary. So I want to bring you in, Professor Cotton, to weigh in what the audience just asked. But before we head to that, I want us to understand that when we talk about education, it's not only university, much as most of us here are actually from the universities. I want to bring in different institutions, that could be able to help us achieve these SDGs. Do you think we have the appropriate structure model of academic public health institutes in achieving public health for all? That's on top of what the three people asked in the audience. Thank you.
Thanks, Maggie. It depends where you're sitting. I mean, some of us would say yes, some of us would say no. But it comes back to something Mary said right at the beginning, and Olu was saying about multidisciplinarity, about complementarity. Olu mentioned the leaks. There's lots of leaks that happen in systems because people don't collaborate. People don't recognize one another's skills. We still, within health professions, rely on a hierarchy to drive healthcare. Nurses should, in my opinion, lead healthcare teams in secondary care, in primary care. We spend, in Europe, 95% of all healthcare activity happens in primary care, and yet, as Mary says, 95% of the total health budget is spent in secondary care. Without being able to rely on institutes such as our geographical information systems, colleagues, the GIS systems, looking at our centers of excellence in Internet of Things, in big data, in biomedical engineering, in vaccines and health supply chain management, and all of the institutions that they bring together, including the commercial partners. Unless we do that, and unless we do it in the most respectful way possible, it's not going to happen, Maggie. And I think it's because it comes down to the most basic thing, and that is values. And first day in medical school, first day in nursing school, first day in dental school, first day in pharmacy school, we tell you about academic regulations. We tell you how clever you are to have got to this point. We tell you that you're the cream of all the secondary schools in your country. We blow you up to be the most arrogant people that have ever walked on this planet. And Olu was right. When we went to medical school at the same time, Olu, everybody wanted to be a neurosurgeon or a pediatric cardiovascular surgeon, And what are the values that drive all of you guys? I would suggest that they're values of love and they're values of justice. And that's what we should be spending first day in pharmacy school, nursing school, dental school, allied health professions school, medical school on, is working on values. The kind of values that cause you to express supreme humility, supreme humanity, and cause you to work as hard as you possibly can. And my colleagues know that I believe there's a very simple model for health professions education. And it goes back to the mid-1990s. And there were two films that came out of Hollywood. One was called Sister Act, and the other was called Sister Act 2, starring a woman called Whoopi Goldberg. Those films express everything you need to know about health professions education, about values, about motivation, about inspiration. And Whoopi Goldberg sings a song, and it goes like this. If you want to be somebody and you want to go somewhere, you better sit up and pay attention. So we come to meetings like this, and we spend our time on our phones and on our laptops. You better sit up and pay attention when you go back to your schools of learning. You better sit up and pay attention. But when you're here, but I also expect you to get up off your seats and pay attention, to go out with that cloak of humanity and humility and touch the dirtiest, smelliest person you can find. In fact, embrace them. In fact, hug them. And in fact, find out what really matters to them. Because I told you I care for victims of torture. When I ask them what matters to them, they say the warmth of another human being. They say the noise in the corridors where I live. You know, because it makes me feel like prison. It reminds me of the noise in prison. And then I get that anxiety and that panic attack. That's what really matters to people, giving people the confidence and the ability and the capacity and the opportunities to be the human beings that a Creator God intended them to be. And that is your calling as healthcare professionals. And Maggie, I would take it back to values every time.
Before I go back to the audience, I want us to touch more on capacity building. Dr. Olu mentioned it earlier, but I know, Professor Cotton, you've put a lot of efforts towards this, especially at the University of Rwanda. Now we can build all the best hospitals. We can do all the research and have even the best booming economies. But if we still have a huge skills gap, I think we still have a very big challenge. I want to find out from all my panelists, how do we address this?
Okay, I am a strong advocate of capacity building, but capacity building is not only about sitting in a classroom. It goes beyond that. When I look at, and coming back to financing just briefly, for instance, when I look at the amount of money we spend on workshops, you know, training people over and over again, is huge. This money can go to other things. So first of all, how do we build the capacity? Let's start from the person himself. We have the internet. We have, you know, you have all the information at your fingertips. You know, sometimes when I want to learn about something, I pick a topic which is not even related to medicine. I go to the internet and I do my research, and by the time I finish, I'm almost like an expert. So that is, for me, the starting point. Secondly, practical training in itself is about, like the professor said, talking to the people, understanding what they need. In so doing, you build your capacity. You understand what they need. You can see the environment. So for me, I think this is another area which is really important. Of course, we also have, you know, on-the-job training, which for me is important. We don't need to take healthcare workers out of their, you know, duty post to train them. So having an oversight system to supervise them. You go out there, you watch what they're doing, you provide support. For me, that is also capacity building. Thank you.
Capacity building is critical, and it really is, I think, an opportunity to address the distribution of the information to the right people in the right places. In the US, I was part of a program early in the HIV epidemic in the US in the 80s and 90s, and we developed a Train the Trainer program because we knew we had to train large numbers of the health workforce, including the housekeepers and the dietary workers, It wasn't just about the skilled staff, it was the entire team needed to understand what the nature of the condition was, what was safe and what was not safe. So I really became a big fan of the Train the Trainer program. GEI, which you know is one of your sponsors, has had great success in Rwanda, Tanzania, with helping babies breathe, which is a very practical approach, teaching the right people how to intervene at birth. And there are programs here, you'll see folks who are your local trained individuals who will be able to demonstrate some of these skills. And that's capacity building. It doesn't mean someone's flying in from somewhere else. It's where people are living. They are given the opportunity to learn the skills that are meaningful to them to participate in improving health and improving care. So it's a wonderful, wonderful structure.
You want to weigh in, Professor?
I don't really have much to add to that, except that Olu and I were talking earlier about the huge amount of money we spend globally on training and workshops, and to what effect, to what benefit, because people often don't have a mandate when they return from a workshop to actually make a difference. And I see lots and lots of CVs from people, and their CVs, 60% of the white page space is taken up with a list of workshops attended. And you think, what's the point? What does it tell me about this person's ability to make change or to do anything at all? One of the things that we've done is in the last 3 years, we've launched the first ever master's programs for nurses. There are 8 specialty tracks, 160 nurses trained. And we selected them from the 9 provincial and teaching hospitals in Rwanda so that we could train them up to lead healthcare teams, as Olu said, to have a real perspective on research, as Mary says, to be able to interpret evidence properly. And we've pushed them back out into the hospitals with support. But you need to keep reinforcing and consolidating for people when they emerge from any form of training. The other thing that we've done, and I think it's something that we often forget, is the impact of oral health on people. The morbidity that comes from having that jaw that avoids you eating and getting proper nutrition, that causes all those other kinds of knock-on effects with preterm labor and cardiovascular disease. So actually building capacity in those areas rather than keep doing the same things over and over again, because then we just keep getting the same thing over and over again.
If no one, unless anyone has, okay. So I want to come back to you. Like I said, the conversation is all about you. Any questions? Okay. And please, when you treat your questions, you can use the hashtag WHSS2017. Otherwise, if you don't use the hashtag, we won't be able to see your questions. Even though we might not be able to read some of them here, but I'm sure the panelists are connected. They will probably be able to respond to the questions. Let's start with the first question.
Thank you. Thank you so much, everyone, especially the panelists. I have really benefited a lot. I'm an Ekan from Nigeria, and I have a question to ask, which is quite related to the theme of the event. My question is, and it's basically going to be about Africa. Apologies to others, sorry. Is there a significant challenge in the way different healthcare professionals in Africa work, like the pharmacists, the doctors? Is there a significant challenge in the way they work compared to other regions? That's the first question. Then the second would be, can this challenge we've identified mitigate we achieving the health goals of the SDGs in 2030? And then the third question would be, how can the challenges that have been identified be addressed for us to reach the SDG 2030 goals?
Oh, thank you. My name is Alois Aime. I'm a nutritionist and I'm proud of it. So my question goes to our principal, Philip Cotton. He said we should sit up and we move up and move up. We move up. But as I need to ask about capacity building as a principal, like what are new approaches that are being in place to make
the students that are lagging out because of experience so that we can boost our health care system? Thank you.
Hello, my name is Ishmael Aitijalo. I'm from Sierra Leone. One of the speakers made statement about advocacy. I used to lead an advocacy network on neglected tropical diseases. And as we all know, these are diseases that affect the world forest, and then they have longer incubation period. And one of our main thematic areas was on advocacy. We used to advocate for more increased financing on entities. Even the time of President Obama, we advocated, and then we see that there was more increased finance on neglected tropical diseases. But when there was a change of government, the new president, there was a cut down on entities, and that even affected our initiatives as students. And so I want to also come to use this podium to continue advocacy, to advocate on more increased finance on neglected tropical diseases. And the impact is so much, and these are diseases that actually affect the world forest, and then they have longer incubation, and they are asymptomatic, so it's difficult to treat. And so as students, we have been involved in raising awareness, advocacy, and also in Sierra Leone, students, we have been encouraging other students to support the Mass Drug Administration. So I want to advocate for more increased funding on neglected tropical diseases. Thank you.
Okay, thank you very much. My name is Emmanuel Emisakobina from Ghana. I'm also the president of African Dental Students Association. My question borders on capacity building. And we have looked at it from the educational point of view and then the social point of view. Can we move into the political point of view? How is politics affecting the attainment of the SDGs in Africa? Considering the fact that when it comes to politics in Africa, we normally get negative media globally as far as African politics is concerned. So Dr. Olu, how is politics affecting this particular area in terms of capacity building? And my second question goes to Professor Cotton. How are you implementing the multidisciplinary approach in research as far as Rwanda and then East Africa is concerned? Thank you very much.
Okay, let's do this. We let the panelists answer the 4 questions because I don't want them to forget anything. Then we can come back for the next set of questions. Isn't that okay? Thank you. Dr. Lu, we start with you.
Okay, I thought I was going to get away very lightly, but when I see the questions coming from the audience now, it's getting challenging. Thank you very much for these questions. I think I'll start with the gentleman from Nigeria, not because I'm a Nigerian, but he said, you know, his question was about, are there different ways in which healthcare work across the different areas? Yes. You know, even the cultures are different. The way we approach issues are different. So for sure, there's that difference. And I will give you a very good example. You can imagine if you put a healthcare worker in northern Nigeria, you know, in the family planning clinic, and an 18-year-old comes in to ask for family planning services. His reaction, or her reaction, will be different from a healthcare worker sitting in the United States of America, because the culture is different. So for sure, we have, you know, these cultural differences that, you know, we need to address. And I think, again, it goes back to the training. When we start with the training, we also need to start to drum some of these things about the fact that, yes, our healthcare delivery needs to be context-specific, but a lot of time we need to leave ourselves sometimes and wear the uniform of a healthcare worker, leave our culture, leave our religion, leave who we are, so that we can, you know, deliver healthcare, you know, in a very, you know, credible manner. Now, the issue of advocacy on NTD, I know it's more of a comment, but just to let you know that a lot of work is going on NTDs. And for us as WHO, and working with a lot of partners across the academia and also the private sector, a lot of work is being done, you know, to ensure that we address the issue of NTD. So NTD is not falling within the cracks. It's really something that is on the table. How does politics affect SDG and capacity building in Africa? Politics is everything. And that is why, if you remember, I did say it's important for you to get involved in everything. Get involved in politics. Because when you get involved in politics, you can influence a lot of things. Look at it. Anything that happens in a country is about political leadership, isn't it? So I give the example of Rwanda, where I'm sitting. Good political leadership, good governance, translated into achievement of all the health-related MDGs. The country today has one of the best, if not the best, community-based health insurance. That's because there was political commitment to make it happen. So politics has a lot of influence on what we do in health. And in as much as we as healthcare workers were not politicians, we must understand the political dynamics and how it affects health. Now, capacity building specifically, a lot of time, the quick win, the quick fix most of the time is capacity building, okay? Because, you can organize a workshop very quickly. It's different from saying, look, I really want to deliver services. So, a lot of times, if you look at national government, they want to do more training because, we have trained so many people, we have done this. But we as healthcare workers, we need to start to get involved and tell them, look, it's not only about training alone. We need to look at the other aspect. We need to advocate to them. So politics, for me, is really very important. And as healthcare workers, healthcare professionals, we need to understand the political dynamics as it relates to us as healthcare workers. Thank you.
Mary, you want to weigh in?
Well, I'm a strong believer in being active as well, and it is, politics are local and global, and it's imperative that you as health students and future professionals be part of the conversations in your home countries and in your home communities, so that you can educate others and advise others about good health practices, public health policies, and infrastructure. Because politicians, many are very good people, but they may come from very diverse backgrounds and not have the perspective that you're bringing. So without your voices, their information will be very limited. So I'm a strong believer that the SDGs represent for all of us goals. And goals are very important for all of us, whether it be our personal weight loss or getting the degree from your school or getting the placement in the position that you want. Without goals, we don't strive and we don't move forward. So there's an organization called the Institute for Healthcare Improvement. They're an international organization that works on quality and safety, and they really teach a lot about how to measure quality and safety. And their message is you have to have big, audacious goals. You have to strive for the greatest, and then continue to work toward that. So in their mind, it's progress, not perfection. So whether every goal will have 100% measurement at the end of this process will not mean that there was failure. It will mean that there was effort, and effort will lead to successes, and success will build on success. And striving for those goals will give us a clear picture of where we want to go. Then we'll have new goals, obviously, to set and to continue to work on that pathway. So it's really a process. It's a constant journey and a journey of continuous improvement. And I think as well the SDG conversation should keep us on that pathway, continue to monitor, to continue to measure, and to be optimistic about that which is achieved and challenged by what is left to be done. Thanks.
Thank you, Maggie. I'll just focus on two of the questions, I think, about what are we doing around SDGs. Well, in the university, we run a university that, like all universities in the world, has its own share of politics, but, we work in departments and schools and colleges. And what we've done is we've repositioned ourselves to move towards disciplines. And so we now have 6 research clusters in the university, and they have to be multidisciplinary. So we have a research cluster that will take in issues of One Health, So does that include healthcare professionals, plant professionals, from agriculture, and animal professionals from veterinary medicine, but actually also economists, also so many others. The cluster around transport that includes transport and logistics involves the social scientists. If you want to teach people to build bridges, civil engineers, to build bridges to connect communities, then they have to understand the lived experience of the people living in those communities that are suddenly going to be connected. So we've developed these research clusters. We're going to see a breakdown of departments, but we have to keep challenging what we do, and so challenging the model of education. Now, the model of education at the moment in many universities around the world that train healthcare professionals is that it's something that we do to you. You only get credit for the things that we do to you. I want to see students getting credit for things that they do. I want to see students, not only worried about how many times they get to go on ward rounds with professors in teaching hospitals, but how many times they go out to the local deaf school or the local school for children who are visually impaired, the number of times they go out and work alongside community health workers, the number of times that they go out and work with NGOs. And for students to demonstrate to us what they get credit for and what they should get credit for. I want to see a greater emphasis on students engaging in areas that students often shy away from, such as psychological health and mental health. And also students who innovate and get involved in entrepreneurship in healthcare, so that we can begin to award you things for those, because they will be much more meaningful, and it will break us from this model of higher education around the world, which means that bit of paper you get on graduation simply shows that you can pass an exam. And so we have to reform. And we believe that one of the places where you can make these changes, because this place has proved it many, many times, is Rwanda. And because of a political leadership that actually values each and every human being. So that's a bit consistent with our hopes and dreams as healthcare professionals. Thanks, Maggie.
We'll take the next set of questions, and then we will come to the end of the conversation. Like I said, if we don't take your questions, you can ask the panelists on Twitter using the hashtag. I'm very sure they will. Will you, panelists? Yes, they will. So one of the things the SDGs address is gender equality. I really want to see some ladies asking questions.
I have a question, and I'm a proud healthcare leader and also a woman in working in global health. So actually this is a perfect segue. My name's Paisley, I'm a registered nurse from Canada, and I'm also the president and co-founder of the Global Association for Student and Novice Nurses. We talk a lot in healthcare about gender, especially in the health workforce. And when talking about capacity building, I think that's a really important factor to bring up, because it's estimated 50% of the world's work in caregiving is done by women, and it's unpaid. So I'd like to hear what the panelists have to say about how gender equity, equality, it's not just about women and men, it's not about gender parity, it's actually about, in society, the roles, expectations that we have and how that influences the people in this room today, and being able to enter political leadership in your own context. I think that has a huge role that we haven't talked about yet. So.
Ladies.
Good morning. My name is Letla Khanola from South Africa. I'm a pharmacist by profession, and I work in PhD facilities now in a particular province, and we're working on ensuring medicine availability in primary healthcare. So my question will touch on basically almost all the goals. As much as we are healthcare professionals, we're mostly focusing on goal 3, but how about at some point we need to take off our heads as health professionals and look at all other goals. For example, whether you are a pharmacist, an engineer, or wherever, all the goals in a way are interlinked. And if we are able to build capacity in civil society, we can start by schools, primary, high school. If you teach the kids how to wash their hands, how to eat healthy, and how to save electricity and water, those things eventually will work out to assist in other goals and also ensure sustainability. As a child, you grow up, this become a way of life. I think in terms of sustainability, we can look at it in that way, but I just want to ask, how much support do we have from our the education side in terms of training, our ministries of education, to have enough support to train civil society, kids, and all other individuals except professionals to assist? Because for us to achieve all these goals, we all have to work together, professionals or not. Because if we can all work together, we will see all these goals as they interlinked, and we see the last goal which talks about partnerships and allow sustainability. So I just want to ask, how much support do we have from the Ministry of Education in terms of capacitating and allowing other civil society members to be able to participate and assist in implementing these goals across the globe?
Hello, so my name is Joseph Milmier.
Are you a lady?
No.
Okay, you ask the question and then we give the microphone to the lady here. Go ahead.
Okay. My name is Christophe Mumia from University of Ibadan, Nigeria, and I'm a director at the Federation of African Medical Students Associations. So I have two questions. The first question is about interprofessional rivalry, especially in my country, Nigeria. I mean, there's a lot of rivalry between nurses and doctors. So it's very hard getting the different healthcare professions to work together in order to achieve the sustainable development goals. So maybe Dr. Olu has, at least since it was working in Nigeria before he came, if he has an idea of how we can actually fix the interprofessional rivalry. And the second question is on cultural perspective and healthcare, SDG 3. For example, we did a breast cancer awareness program, a Pan-African awareness program at the Federation of African Medical Students Associations recently. And traditionally, we do go to cities for free screening exercises and awareness programs. But this time around, we're like, let's go to the remote communities, a very remote community in Ibadan, like an Ojaoba. So what we realized there was that people actually don't want healthcare. I mean, we're doing awareness programs and screening exercises, and people are like, no, that's not what we want. We want money. We want good food. We want this. And we're very surprised that even people that we're trying to help, they actually don't want this. So how can we fix this? How can we get around to actually even getting people to want healthcare interventions? Thank you very much.
Good morning. My name is Ivy from the University of Nairobi, Kenya. And my question is mainly directed to Professor Cotton. One of the things you've talked about is how in Rwanda you're really developed in research. In University of Rwanda you're really developed in research. You have so much in research. And as part of the East African community, we need to work together. And most of the risk factors, most of the issues in health that affect Rwandese people here also affect us in Kenya. So my question to you is there a platform for partnership between not only just Kenya, but East Africa as a region to be able to develop our healthcare systems? And if you've been following Kenyan healthcare, you know that we've been having some challenges, and we'd want to be able to come forward and grow and develop to such a position in which Rwanda is at. So my question is there a platform, and how can we get into it? How can we start this conversation?
Thank you. My name is Mary Sharon Furaha. I am a graduate from Kepler program. So my question goes to what Dr. Olu has said about capacity building. You've said that much money has been invested in capacity building, especially in workshops. So I would like to know how much efforts do we invest in evaluating the impact of the workshops in the community, and what can be done to make the impact more beneficial to local communities? Thank you.
Hello. Yes, sorry. I'm Fumbi Okoya from Nigeria. And the question I have is as regards health and health policies, particularly in probably less developed countries in Africa. First, I would like to establish that health is the backbone of mankind. Without good health, countries would be barely large land masses of graveyards. And so if we are going to try to emphasize the importance of health, it is really important for government to prioritize health over everything. Even security should be secondary to health because dead people don't need to be secure. So I would like to ask, what precisely, I would like to also agree with what Dr. Olusonya said as regards healthcare workers getting involved in politics, in policy making, because policies are really important in healthcare. But I'd like to ask what, so far, particularly WHO, is doing, probably liaising with the United Nations to get heads of government to prioritize healthcare over other sectors in available, because without good health, other sectors are going to suffer. I would also like to inquire from other members of the panel how they think we can get governments to prioritize healthcare either by increasing remunerations for healthcare workers, hiring more health workers to reduce understaffing, and prevent healthcare workers to be too stressed to focus on research, because it's really a common occurrence for health workers, particularly in the hospital settings, to be too stressed to even think about research. Thank you.
Thank you. Now, okay, you're the last person who's going to ask a question. I'm sorry, but we cannot take all your questions in an hour. We cannot finish this conversation in an hour, but I'm sure the panelists will be available during the break to take all your questions. Go ahead and ask, and then we can give them a chance to answer.
Yeah, my name is Esther Mary Masakoi from Sierra Leone. I'm a pharmacy student, a finalist. Towards the SDGs, and we have been looking at health, but like some of the panelists were saying, it's not just about health. For us to reach the SDGs, we have to go back from the grassroots and teach people how to engage themselves in what they know how to do best, so that at the end, they can develop themselves, and that will help in poverty reduction. That will aid the whatever we want to do, because if people don't have the knowledge of what you want to bring to them, it becomes a difficult thing. So, like Professor Cotton was saying, they changed their educational system in as like foregoing all those big textbooks and using a more sophisticated system of research and the like. So I would like to ask, how did you do it? Like the processes involved, so that we can learn from it and we can go back to our respective universities or colleges or wherever we are from, so that we can teach them, and with that we can improve. Thank you.
Thank you. So we are done with the questions. You know, we cannot achieve the SDGs if we cannot keep time. So we need to do other things. Let me just give the opportunity to our panelists to respond to your questions, and send the questions using the hashtag. They will respond. Thank you. Let me start with Mary, gender equality.
Gender equality, yes. Thank you. Great questions, and far too much content for us to digest in 1 hour and to give you good answers. So we will be using the technology, and certainly here for the conference. I just want to comment in general, and it's really a quote from Dr. Tedros, who's the WHO General Director General, that no health system is perfect. WHO's experience, expertise, and technical know-how are all assets from which all countries can benefit. So this kind of a conversation, a sharing of the priorities from your country, the learnings from other countries, and the partnering will probably lead us to accomplishing many of the goals and get our work moving forward. So thank you.
Okay. I seem to be a bit popular today. I don't know whether it's because we have a lot of Nigerians here. But first and foremost, let me start from the last question, which was directed to me, about what WHO is doing to advocate for health. First and foremost, I want to remind you that WHO is a member state organization. So the people you see in WHO, they are only the secretariat. All our decisions are taken by the ministers of health of your countries. So it's not by us. So that is one of the things, we're doing. And because of that, we have the World Health Assembly, where we, based on our work in the countries, we look at what the issues are, and then we present them to your ministers of health to say, look, this is what the situation is. This is where we think you should put money. This is where we think politically you should act on. So this is one way. Of course, in each of the regions, we have 6 regional offices. We have what is called the regional committee. They take place once a year. Again, ministers of health, they are the ones that take all the decisions. And what we do is that we provide them the evidence based on our work and our partnership, to take decisions. We do also undertake advocacy on specific issues to member states. For instance, the issue of Ebola, when we had the outbreak in West Africa, there was a lot of advocacy, not only to the heads of state of the countries that were affected, but to even the other countries. For instance, some countries were going to close their borders, and we needed to medically evacuate some people because they needed to get more health care. So a lot of advocacy, went into place to do that. Recently, in this beautiful city of Kigali, we organized the Africa Health Forum. And the Africa Health Forum, again, was an opportunity, to advocate to healthcare leaders about what needs to be done. We do, of course, work with our regional economic communities. For instance, we collaborated with the African Union to set up the Africa CDC in Ethiopia. And that is a joint effort working with heads of state to look at how can we improve global health securities in Africa. So these are some of the things that we do. Now, there was a question on the impact of training. Unfortunately, most of the time, we only measure the output. We have trained 10 people. What was their knowledge before and after? We have actually not managed to translate these to looking at what is the impact on improved service delivery. So this is a point that, again, we need to work on. We need to go beyond this issue of, okay, we have improved his knowledge, but how has that translated into improved quality of care? So we need to really emphasize a lot more on supervision, on monitoring and evaluating, the people that we have trained. Now, there was a question on the cultural perspective. People don't want healthcare. They want something else. Remember what I said this morning. The people are important. We wear nice suits, sit in air-conditioned offices, appear to them in a nice Land Cruiser. They want to be like you. And we go to see them only when we need them. So how do we address this issue? We need to engage them more. And we don't need to engage them based on the perspective of one thing, health. No. Let's ask them, what do you need? Okay, I need money. What do you need money for? They will tell you we need money for food, for whatever. All these, remember I said today, these are the social determinants of health. If a man doesn't eat food, he doesn't have a home, how do you talk to him about health? So again, it comes to the issue of looking at health from a very holistic perspective and ensuring that we keep communities as number one when we talk about health. Interprofessional rivalry, it's really typical, and I think Nigeria is number one culprit on this. I remember as a young doctor, we were really arrogant, and there was always a battle between us, the house officers, and the senior nurses in the clinic. But one lesson I pulled out of that is, as young professionals, I often run into problems. I need my consultant, I need my professor. At that time, the matron will come to you and say, you know what, the professor did it like this the last time, and I learned a lot from that. So I call upon you again, you the young healthcare workers. From this meeting, we have said multidisciplinary, multi-sectoral. We need to work with each other. As a doctor, you cannot perform a surgery alone. You need a full complement of people. As a pharmacist, you need the doctors to prescribe. You need people to work with you. So I must say that we need to work, a lot together. How much support do we get from the other sectors? I think, again, this is context specific. And if you remember today that, the professor did allude to in Rwanda, we have the different sectors, but they have been clustered together. And they meet. There's a platform where we meet to discuss across the board. In fact, as I speak, one of those meetings is actually going on. So we have that mechanism to actually engage across all the sectors. But again, the message to you today is that we need to do more in terms of that engagement. We as healthcare workers will not do it alone. We need to do more. Lastly, gender equity. It's changing. It's changing. Again, I'm not saying this because I work in Rwanda, but this is a country that has shown that the gender equity issue can be addressed. So when you go to the parliament, more than 65% are women. And when you go to most of the sectors, it is changing. I agree we need to do more, but I think the change is on the way, and it's for us as healthcare workers to see how we can contribute to that change. Thank you.
In fact, when you look at the podium, 2 to 2, it's probably changing. Let me give you the opportunity to come in, Professor.
Thanks, Maggie. Gender equality, I mean, it's all about deeply held prejudice and bias that we leak unwittingly. And my own personal experience from my childhood is reflected in a situation whereby if your daughter gets pregnant, you exclude her from the family. You're disgraced by her. But if your 15-year-old son has made a girl pregnant, you don't even want to know about it. You don't do anything about it, so when my sister got excluded at an early age for getting pregnant, and my brother and I said, hey, hang on a minute, do you not think we might have, and parents said, oh, shut up, we don't want to know about that. So I think, we have to be really careful, and we have to demonstrate gender equality throughout. And I think it comes down to simple things sometimes, Maggie. And I spend a lot of time in the university going through documents where I reverse 2 words, because all the documents will read he stroke she, or him stroke her, and I reverse them all to she stroke he and her stroke him, because I think it's subtly important. We leak prejudice if we say, if a student gets into financial debt, he should approach the university registrar, or he should approach the university registrar. But we need to face up to the fact that we have to go beyond gender. We have to also engage around sexuality, which is a difficult thing for people of faith, people of particular cultures and contexts. But it's vitally important, otherwise we find ourselves unwittingly saying to a woman, how's your husband? And really, oppressing her in a major way. And gender, the whole issue about gender equality, I think, is largely about oppression. The colleague from Kenya, yes, we do. I was in University of Nairobi a couple of months ago talking with vice chancellors in the region and research leads about what we're doing. We have consortia like Carter, IUCEA, which brings us all together, and then consortia that bring us together because we share the same funding partners. We also share the same interest in quality and standards in professional education. And those people who very kindly suggest that what I've said paints a picture of glory and wonder. There is a mismatch for people sometimes between the headlines and what they feel on the ground. And that's why the only future for health professions education is the people who are going to become the future health professionals, which means that we have to engage with people in the here and now. So thank you, Maggie.
So as we come to the end of this conversation, moving forward, it's very important. You just touched on it, but I think we should drill into much more on how to monitor this progress, especially because we want to know where we're heading, where the loopholes are, and if we have actually achieved these goals. I want to hear your thoughts. How do we measure the progress? How do we monitor it?
I think at the end of the day, when we talk of healthcare, it comes at the end of the day to mortality and morbidity. How many people are getting sick and how many people are dying. So this is the end point, and we need to look at how do we measure that end point. And it's about what we call the vital statistic and civil registration. We really need to strengthen, that system to be able to capture how many women are dying, how many children are dying, where are they dying, and how, can we address some of these deaths. The second is about looking at, specific areas of research, and we have spoken about that today. For instance, again, I come back to Ebola, where we saw it happening in West Africa for the first time. We are still baffled. Why did it happen? And why did it go to that scale? So we need to have a good research agenda to look at some of the issues. So that will help us to actually track what the problems are and also understand how we can deal with some of these. Of course, there are other methods that we use, the demographic and household survey. This helps us to look at where we are over time. We usually do it every 5 years, and it's something that measures at intervals where the progress is. So these are the main areas. Of course, on a day-to-day basis, like I said, we need to do supervision. We need to go out to the clinics. We need to talk to the people and understand whether they're really involved, whether their perspectives are changing, whether they are actually happy with the kind of services they're receiving. So these are some of the ways I will propose. Thank you.
That is exactly what I was going to say, and I'll just reinforce it. Our tendency is to do a lot of process measures, things that were done, some outcome measurement in terms of looking at the rates, infectious disease rates, mortality rates, maternal deaths, and those are numbers. They're very important. They become a benchmark of sorts, but the sense of satisfaction and well-being, I don't want health care, but I would like to have good health and a healthy life, is very important to be asked and to be understood in a deeper manner. So it will probably be beyond just outcome measures, but satisfaction, what we call the population's perspective of what they're receiving and what is missing will be very important for us to learn from this process.
Thanks, Maggie. I agree with what my colleagues have said. So my challenge to students is a simple one. When we look at mortality figures, I want you to think about people who've died without somebody who loves them, people who've died without a name, people who've died without a country or a nationality, people who've died without somebody to grieve for them, and people who've died without people to bury and dispose of their bodies. And I want students to engage in that part of measures as well.
Thank you so much for being part of the conversation. Now, this brings us to the end of the conversation, but before I say bye to our panelists, I want to make this clear to the audience that as young people, you are the future. I'll talk about, in the case of Africa, the population is set to double. We're going to be the population of India and China combined in 2050. Meaning we're going to be dealing with an increasing population, but also diseases will be becoming innovative. More and more diseases will be, coming up in the near future. And everyone, each one of us here has a role to play in their own capacities, from your families to your societies, before you actually head to your offices or hospitals. And that brings us to the end of this conversation. Thank you so much for being an amazing audience. keep the conversation going. The panelists will be available, I'm sure, for the next few minutes or the rest of the day to answer the rest of your questions. Enjoy your stay in Rwanda. And thank you so much to our panelists. Can we give them okay. And to myself. Thank you so much, and have a lovely day.
Thank you very much. I hope this panel was really wonderful and educative and has given us a direction for the rest of the theme. They have tackled the theme on both ways, SDGs and multi-sectoral collaboration. I do believe it gives us the right direction for the next couple of the days that we shall be here.
Yes, I do believe they do deserve another round of applause because that was an incredible session. So before we move ahead with the program, I would like to give maybe a little bit summary of what just went on. Thinking of our fellow delegates who do speak French. J'espère que mon français n'est pas trop rouillé. Donc, je vais essayer de faire un petit résumé de la session qu'on vient d'avoir. On parlait de comment atteindre les objectifs de l'agenda de 2030 en ce qui concerne les objectifs de développement durable. Qu'est-ce qu'on peut faire? On a parlé de la recherche, l'importance de la recherche, mais des recherches vraies qui vraiment parlent de la communauté et des choses qui sont en train de se passer en ce moment. On a parlé de comment faire en sorte que les budgets qui sont faits par les gouvernements ne soient pas dépensés pour rien. On a donné des exemples des médicaments qu'on achète par an, mais qu'on a encore des budgets, des statistiques qui nous montrent qu'on a beaucoup de médicaments expirés ou non utilisés. On a parlé de faire plus pour la communauté en faisant des formations, en donnant des formations dans les écoles, dans les communautés, en commençant vraiment dans des niveaux les plus bas pour vraiment avoir un vrai impact sur la communauté. On a donné beaucoup d'exemples des choses qu'on peut faire, par exemple des formations sur l'hydratation, sur la sanité, sur ces choses vraiment qui changent, ces petits gestes de la vie, ces petits gestes de la vie quotidienne, mais qui ont un impact assez grand. Je crois qu'on a aussi parlé du fait que, bon, bien pour résumer, ces gens seront là pendant toute la journée. Si vous avez des questions, des suggestions, vos pensées que vous voulez partager avec eux, ils seront là pour vous. Alors, je pense que le mieux maintenant, c'est qu'on continue avec notre programme parce qu'on n'a pas beaucoup de temps. So now switching back to English. So to prepare ourselves for this next session, so to keep up our energy.
Yes, we are going to have our energy break, and just to let you know that some of these discussions and some of these, there are some people who have some abstracts, there are people who have some research based on multi-sector collaboration and all other sessions that will be discussed during the whole of the day. So for those people who want to present their posters and your posters within the following topics, multi-sector collaboration, technology in healthcare, mental health, migrants' health, and financing in healthcare, you'll check within Virunga. There is where your poster number is pinned already. So whenever you find your poster number, you put your poster, and people come to visit to visit your posters during the tea breaks, lunch breaks, and in the evening.
Yeah, so we'll be having a tea break. So for the guests and our speakers, that will be in Bamboo. The ushers, please help us. So the exit will be right here on the left. For the rest of us, for the delegates, we'll be using the right going to Virunga. Maybe I should...
Yes, so without any further ado, I would say bon appetit and let's keep networking.
Yes, enjoy and let's have a good time.
We have strictly 30 minutes to be back for the next session. Thank you.